You could have dangerously low testosterone right now and still be hitting the gym, having sex, and living like nothing's wrong. But behind the scenes, your body is warning you, and most men miss the signs until it's too late. If you're a man over 30, there's a real chance your testosterone is low even if you feel fine. And if even one of these 10 signs shows up in your life, you're already late. The problem is, we've been trained to believe testosterone is just about sex drive and muscles. But what if I told you it affects your sleep, your energy, even your patience with your kids? I'm Dr. Max, urologist and men's health expert. Every week, I meet guys who think they're fine until I ask a few simple questions. And suddenly, the puzzle pieces click. One guy told me, I've been waking up to pee for months. I've lost my drive, and the gym just isn't working like before. His blood work showed testosterone levels of a man twice his age. That's the silent trap. Testosterone doesn't crash overnight. It fades slowly, quietly, until you wake up and realize you don't feel like you anymore. In this video, I'll walk you through 10 surprising signs of low testosterone. We're not just talking about sex or muscles, we're talking about your life. Every 90 seconds, I'll drop a question most men never ask, but should. Stick around, because if you catch this early, there's a lot you can do. But if you wait, your body makes that choice for you. Let's start with something you'd never connect to hormones: waking up to pee at night. Most men blame it on a full bladder, or the tea they drank before bed. But here's the truth: if you're under 50 and you're getting up regularly to urinate at night, that's not normal. It's not aging. It's not just how things are. For many guys, it's one of the first signs of low testosterone. Now here's the kicker: it's usually misdiagnosed as prostatitis. So you go to the doctor, get handed antibiotics or prostate pills, but nothing really changes. Because the real issue isn't infection, it's that your hormonal engine is running on fumes. Testosterone plays a key role in how your bladder and pelvic muscles function. When it drops, your pelvic floor weakens, your bladder control gets lazy, and suddenly you're making 2 to 3 bathroom trips every night. Even if your prostate looks fine on paper. That affects your sleep, your recovery, your energy the next day. Everything starts breaking down. You're more tired, less focused, and over time, that adds up to burnout. I had a patient, 39 years old, fit guy, worked in IT, lifted weights, didn't drink, but he kept waking up at 3 a.m. to pee. He thought it was just stress, but his testosterone was barely scraping the bottom of the normal range. We got him on the right track, and within weeks, his sleep changed. His focus came back. That one little sign opened the door to getting his life back. Quick gut check for you. When's the last time you actually slept through the night? No bathroom trip, no tossing, no staring at the ceiling at 3 a.m.? If it's been a while, you're not alone, but you are being warned. And your next warning sign? It's right there in the mirror, hiding in plain sight. Your beard. Sounds odd, but stay with me. I'm not talking about grooming or trends. I'm talking about growth. If you used to shave every couple of days and now a week goes by with barely a shadow showing up, that's not aging. That's a hormonal shift. And it's one that can snowball into bigger issues if you ignore it. Men with dropping testosterone often notice this subtle change first on their face. The beard grows slower, thinner, patchier. And it's not just the beard, chest hair, arms, legs. Even armpits can start thinning out. Here's why. Testosterone is what activates those hair follicles. It fuels the masculine traits we take for granted. So when levels drop, those follicles go into sleep mode. It's like your body's slowly dimming the lights, and you don't even notice until it's nearly dark. I had one guy in his early 40s, worked in finance, sharp dresser, always clean shaven. But he noticed something odd. The 5 o'clock shadow? It wasn't showing up anymore. He'd shave Monday, and by Friday, still barely a hint of stubble. Guess what? His testosterone was half what it should have been. We ran labs, made some key changes, and within 3 months, his beard was back. But more than that, his mood lifted, his workouts felt better, and his sleep improved. Because testosterone isn't just about muscle and sex drive, it's your whole system. Now here's something most men never say out loud. If your testosterone dropped by 30%, would you even know? Or would you just keep pushing, keep training, keep adjusting? Until one day you look in the mirror and think, when did I start looking like this? Let's talk about that belly. Not your gut instinct, your actual gut. You know the look, arms and legs still slim, but the stomach sticks out like it doesn't belong to the rest of your body. That's not laziness. That's not age. That's one of the clearest body signs your hormones are not working the way they should. And no, more crunches won't fix it. This is not about discipline. It's about hormones. When testosterone drops, fat cells start to pile up deep inside your abdomen. This isn't just surface fat, it's visceral fat. It wraps around your organs. It messes with your insulin. And it sends signals back to your brain that make it even harder to lose weight. One of my patients, 36 years old, ran marathons. Seriously, ran 10 Burmese shots for fun. But his waist kept expanding. His doctor told him it was just age or stress. But when we tested his testosterone, it was 20% below normal. The fat on his belly? It wasn't from food, it was from hormone imbalance. Now, here's where it gets worse. Visceral fat doesn't just sit there. It actually converts testosterone into estrogen. Yes, the more belly fat you have, the faster your testosterone drops. And the cycle just keeps spinning. This is why some guys who've trained for years suddenly feel like their body stopped responding. They're still lifting, still eating right, but nothing changes. Because it's not about effort anymore. It's about chemistry. Here's a quick test. Flex your abs right now. Can you feel the muscle under there, but the belly still pushes out like a balloon? That's not fat. That's internal pressure. And it's often a sign your hormones are out of sync. But the next sign? You won't see it. You'll feel it in your knees, your shoulders, your recovery. And by the time it shows up, the damage may already be done. You're not just getting older. Your joints aren't supposed to hurt this much. I had a guy come in last month, 42, lean, runs marathons, eats clean. And yet every morning, knees on fire. Shoulders feel like they're made of gravel. No trauma. No big injury. Just slow, constant wear. He thought it was just age. We ran labs. His testosterone was in the basement. See, testosterone's not just about muscles or sex drive. It protects your joints, keeps your collagen strong, helps you recover from everyday wear and tear. Low T? Your tendons weaken. Your cartilage thins out. You feel brittle, and most guys have no idea why. And here's the dangerous part. By the time your knees start hurting, or your shoulder clicks every time you lift a grocery bag, you're already way down the slope. But what if I told you weak joints often show up years before your blood work does? Let's hear from you in the comments. Have you noticed weird joint pain or slow recovery even though you work out and eat clean? You're not alone. And it's time more men talked about this. Let's talk muscle. You train. You eat clean. Maybe you've been lifting for years. But lately, the mirror's telling a different story. Your strength stalling. Arms are getting soft. Chest flattening out. And no, it's not just getting older. It's what happens when testosterone drops and your muscles stop listening. See, testosterone is like the foreman on a construction site. When he's around, your body builds, repairs, recovers, grows. But take him away, the workers slow down. Progress halts. And what you built starts falling apart. Here's a reality check. If you've been training hard and still look the same or worse than you did last year, that's not discipline. That's a hormone issue. And I see it all the time. Guys who bust their ass, eat clean, follow every fitness influencer, but can't build or keep muscle. They think they need a new workout. What they need is a new blood panel. Now here's where it gets tricky. Some of the guys with the lowest testosterone don't look unfit at all. They're slim. They run. They might even have abs. But inside, their body is running on fumes. Let's look at what that kind of body can secretly reveal, even when everything looks normal. Here's something most guys don't realize. Being lean doesn't always mean being healthy. In fact, one of the most overlooked signs of low testosterone is this. You look slim, but you feel weak. The wrists are thin. The legs feel hollow. You've got no drive in the gym, and worse, no change, no matter how hard you push. We call it skinny soft. On the outside, you look fine. But inside, your body's telling a different story. And for a lot of guys, this starts early. You're in your 20s or 30s, thinking, I'm good, I'm not fat. But the real question is, how strong are you? Because testosterone doesn't just bulk you up. It gives your body density, stability, the kind of quiet strength that doesn't need to scream. If you're always tired after a basic workout, if you need days to recover from light training, if you can't add a single rep despite months of effort, something's off. And here's the scary part, you might chalk it up to just my genetics or bad sleep and keep going like nothing's wrong. But years go by and suddenly you're not just skinny, you're fragile. Your back hurts, your joints click, you lose your footing more often, and your body starts feeling older than your age. That's why this next sign matters, not because it's obvious, but because it's sneaky. Let's talk energy. Real, day-to-day stamina. Because once that slips, everything else follows. Let's be honest, you ever wake up feeling like you haven't even slept? You drag yourself out of bed, go through the motions, try to shake it off with coffee or a cold shower, but deep down, there's just no fire. This isn't just getting older. It's a different kind of tired. Low testosterone doesn't just affect your sex drive, it affects your motivation, your focus, and your emotional stamina. The little things you used to enjoy, workouts, hobbies, even time with friends, suddenly feel like chores. And the worst part? You start to think this is normal, but it's not. This slow fade, this background exhaustion, this quiet loss of interest in the things that used to light you up, it's a red flag. And no, it's not about being lazy or undisciplined. When testosterone drops, it's like someone's slowly turning down the volume on your life. You still function, you still show up, but it takes more effort, and the spark's just not there. And that has consequences. Because when your energy crashes, everything else follows, your work, your relationships, your confidence. Most guys wait too long. They push through, thinking it'll pass. But by the time they get help, they've already lost too much time. If this hits home, don't ignore it. Because up next, we'll talk about the symptom every man fears and almost no one wants to admit. Let's talk about the thing most men notice, but few want to admit. Your libido. And no, I'm not just talking about sex with your partner. I'm talking about the urge, the thoughts, the spark, that natural, internal pull that just fades. Low testosterone doesn't always show up as I can't perform. Sometimes it's I don't even want to, and that's hard to talk about. Some guys blame their partner. Some think they're just too stressed or tired. Others try to test themselves with porn or a fling just to see if it's still working. But here's the truth. It's not about what still can happen. It's about what used to happen naturally. Let me give you a dead simple test. When was the last time you had a morning erection? Not one triggered by a dream. Not one from stimulation. Just your body doing its thing. Spontaneous. Regular. Strong. If those are gone, it's not just aging. It's a signal. And ignoring it doesn't make it go away. Low testosterone affects blood flow, nerve sensitivity, muscle tone, everything that supports healthy sexual function. So if sex feels less intense, or climax is weaker, or it takes longer to get there, that's not just in your head. And it's not just getting older. It's your body raising its hand and saying, hey, something's off. Now, let's look at why you need to stop guessing and start measuring. You might be thinking, well, I'm not doing too bad. I still hit the gym. I sleep okay. My sex life's not perfect, but hey, I'm not dead. And that's exactly why most men miss it. Low testosterone doesn't hit like a car crash. It creeps in slowly. A few pounds around the belly. A little less drive. A few rough nights of sleep. A dry spell in the bedroom. But you don't realize what you've lost until you get it back. That's why the smartest thing you can do is test when you feel fine. So you know your baseline. Because if you ever crash, you'll know what healthy you looked like. Too many men only check when everything's falling apart. And by then, it's harder to fix. The body's tired. Systems are off. And you're playing catch up. But when you know your numbers in your 30s or 40s, you stay ahead. And you stop guessing. Strong men track their health. They don't just wait until it breaks. If you take care of your car before the check engine light comes on, do the same for your body. So let's bring it all together. You've seen the signs. And maybe you've recognized one. Or 5. or all 10. That doesn't make you broken. That makes you aware. Because what's dangerous isn't low testosterone. It's ignoring it. The guys who wait, who tough it out, who hope it'll fix itself, those are the ones who wake up one day, wondering where their strength went, where the fire went. But the ones who act, they reclaim it. So here's your move. If anything in this video sounded familiar, don't just close the tab. Don't scroll away. Talk to your doctor. Get tested. Know your numbers. And if you're already on this journey, share this video with a friend who needs it but won't say it out loud. Because strong men don't just lift weights. They lift each other. I'm Dr. Max, and I'll see you in the next one. Stay sharp. Stay strong. Stay checked.